African Americans and other oppressed groups continue to face disparities in the American healthcare system. These differences contribute to imbalances in health insurance coverage, unbalanced access to services, and poor medical conditions for certain groups. But then, at a time when no one ventured to question the system, a young black girl with dreams of saving lives proved the impossible, paving the way for every black doctor in America today. Stay with us as we expose what it takes to be a black doctor in the city of America. We'll also chronicle the life story of Rebecca Lee Crumpler, the first African-American woman doctor, and the hurdles she faced. But first, let's discuss the life and contributions of a black doctor in America. I am not sure whether you are familiar with the reality show titled Married to Medicine. It is an American reality television series and franchise that debuted on Bravo on March 24, 2013. The series follows the personal and professional lives of several women in the Atlanta medical community. 4 of them are doctors themselves and the others are doctors' wives. It depicts how the group balances their social circles, careers, and families. This reality series follows members of Atlanta's medical community's female inner circle. They each deal with the ups and downs of being a physician in their unique way, while simultaneously navigating the social rules and expectations of the city's close medical society. So, a quick question: how important is it to have black doctors in urban neighborhoods? Well, to carefully answer this question, let's look at it from diverse perspectives. Number 1, cultural competence. This refers to an individual's ability to understand and respect culturally different values, attitudes, beliefs, and conventions, as well as to analyze and respond appropriately to these differences while developing, carrying out, and assessing health promotion and education campaigns and interventions. It has been demonstrated that black doctors are more relevant in urban environments because they relate better to black patients than their peers. Number 2, patience, comfort, and trust. When black doctors treat black patients, their health improves and their mortality rate decreases. According to one widely reported study, black men who visited black doctors were more likely to follow preventative health measures than those who consulted white doctors. A study conducted by New York University Grossman School of Medicine and NYU Langone Health discovered that patients with hypertension and cardiovascular disease symptoms were more likely to follow medication guidelines when treated by doctors of the same race, including black, Hispanic, and Asian. Other studies have indicated that black patients had better health results and consistently agreed to more and more invasive health tests and interventions when examined by black physicians. Number 3, representation matters. As the United States faces a racial reckoning, obvious disparities among medical professionals persist, with black physicians being especially sparse. When a key Institute of Medicine report advocated for an increase in minority healthcare workers to address long-standing health inequities in 2003, black Americans accounted for 13% of U.S. residents and 3.3% of physicians. Nearly 20 years later, black Americans still account for 13% of the population, but only 5% of physicians. Number 4, health disparities. It is generally recognized that black Americans have a higher prevalence of chronic illnesses such as diabetes, asthma, hypertension, and obesity than white Americans, and they are less likely to receive preventative care. Among all racial groups in the United States, black males have the shortest life expectancies, black women have the highest maternal mortality rates, and black infant mortality rates are the highest. The causes of these disparities, poverty, food insecurity, violence, systematic racism, chronic stress, are exacerbated by the lack of diversity among physicians. Number 5, break down barriers. Equitable healthcare necessitates advancements in both the laboratory and the clinic, and black physician researchers prefer to focus on problems concerning the health of black populations. In an increasingly diverse country, we need more black physicians because they are more likely to work in underserved neighborhoods and conduct research on black community health issues, and because black patients have better outcomes when they see black physicians. With that being said, let's venture into one of the most crucial parts of the video, the Rebecca Lee Crumpler story, and how she took a chance with medicine when no one else would. Rebecca Lee Crumpler, as she was affectionately known, defied the prejudice that barred African Americans from pursuing professions in medicine, becoming the first African American woman in the United States to acquire an MD degree, a distinction previously attributed to Rebecca Cole. Following completing her degree in Boston, she worked in Richmond, Virginia, following the American Civil War, caring for former slaves. But before all the accolades and awards, who was Crumpler, and what motivated her to study medicine? Absalom Davis and Matilda Weber gave birth to Crumpler in Delaware in 1831. Her aunt raised her in Pennsylvania while caring for the town's ailing residents. Her aunt served as the doctor in her village and had a significant impact on Crumpler's desire to pursue a career in medicine. By 1852, she had relocated to Charlestown, Massachusetts, where she worked as a nurse for the following 8 years. Since the first professional nursing school formed in 1873, she was able to conduct such work without formal training. Crumpler was the first African American woman in the United States to receive an MD degree when she graduated in 1864, as well as the only African American woman to graduate from the New England Female Medical College, which merged with Boston University School of Medicine in 1873. So then, what was her source of motivation? I previously mentioned that her childhood was spent with an aunt in Pennsylvania. Crumpler followed her aunt on her frequent excursions to care for sick neighbors. Crumpler said in her autobiography, published in 1883, that her experiences with her aunt motivated her to pursue a medical career. In a letter, Crumpler stated, "Having been reared by a kind aunt in Pennsylvania, whose usefulness with the sick was continually sought, I early conceived a liking for and sought every chance to alleviate the misery of others." Moving on, let's delve into her family life. Rebecca Davis married Wyatt Lee, a former slave from Virginia, while she was residing in Charlestown. They got married on April 19, 1852. A year later, Wyatt's son, Albert, died at the age of 7. This tragedy may have inspired Rebecca to pursue her nursing studies over the next 8 years. Rebecca was a medical student when her husband died from TB on April 18, 1863. He is interred in Mount Hope Cemetery in Boston. Dr. Rebecca Lee and Arthur Crumpler married on May 24, 1865 in St. John, New Brunswick. Arthur was originally enslaved and escaped bondage in Southampton County, Virginia. Born in 1824, he was the son of Samuel Crumpler, who had been enslaved by Benjamin Crumpler. Arthur, his mother, and brothers lived on the adjoining estate of Robert Adams, a large landowner. Rebecca and Arthur Crumpler were prominent members of 12th Baptist Church, where Arthur served as a trustee. Their residence was at 20 Garden Street in Boston. Their daughter, Lizzie Sinclair Crumpler, was born in mid-December 1870, but no additional documents have been recovered. Thus, the child is thought to have died in infancy. In 1880, Crumpler and her husband Arthur lived in Hyde Park, Massachusetts, although they didn't have any children. Dr. Crumpler practiced in Boston briefly before relocating to Richmond, Virginia, after the Civil War ended in 1865. Richmond, she believed, would be a proper field for real missionary work and one that would provide ample opportunities to become acquainted with the diseases of women and children. Almost every hour of my stay there was spent improving in that field of work. Let's see how her life was as a physician. Crumpler began practicing medicine in Boston, focusing on underprivileged African American mothers and children. After the American Civil War, 1861 to 1865, she relocated to Richmond, Virginia, believing it would be an excellent opportunity to conduct missionary service while also gaining additional experience studying diseases affecting women and children. Her experience in nursing and medical school was not simple. In the mid-19th century, women and black men were rarely admitted to medical school. Because of the high need for medical care among American Civil War veterans in 1860, chances for female physicians and doctors expanded. When Crumpler was a medical apprentice, her supervising physician recommended she attend the school because of her talent. That year, there were 54,543 physicians in the United States, 300 of whom were female. None of them were African Americans. Hence, Rebecca Lee Crumpler was the first and only African American physician in her class. Being a black woman trying to fit into a world dominated by white people, she had to face and battle a lot of challenges. She temporarily took a leave of absence to care for her ailing husband, who died of tuberculosis in 1863. She returned 7 months later to finish her last term, but was nearly stymied when certain faculty members expressed concerns about the length of time it had taken her to complete her courses. Several school patrons who were active in the abolitionist movement expressed their support. On March 1, 1864, the trustees voted to award her a Doctorate of Medicine degree. She was 33. She experienced tremendous prejudice and sexism. Working as a physician in the post-war South, she was repeatedly disregarded, slighted, or rendered inconsequential, if not invisible. Crumpler was denied admitting privileges at local hospitals because of her color and gender, had difficulty having prescriptions filled by pharmacies, and was frequently mocked by administrators and fellow doctors. Despite her struggles, Dr. Crumpler remained resilient and eventually returned to Boston to practice medicine and serve children, regardless of their parents' capacity to pay for care. Still, she persevered, knowing that black communities were at a higher risk of sickness due to tough living conditions and a lack of access to preventive treatment. She focused on prevention, nutrition, and achieving financial stability for one's family, all of which are important today, said Melody McLeod, an obstetrician-gynecologist in Atlanta, over the phone. Dr. Crumpler was a trailblazer who paved the way for many other black female physicians to follow and continue to do so. Dr. Crumpler undoubtedly represented the black community throughout her time. She became a voice for the voiceless African Americans and led them to the best of her ability. She also knew and respected the African American values, attitudes, beliefs, and mores that differed between cultures, and she used a thorough approach in her tactics. She became a source of light and hope for all African Americans. He even paved the path for other African Americans to seek careers in medicine. Before we bring this video to an end, we would like to note that Crumpler was an exemplary woman with magnificent legacies to be applauded. In 1883, she released a book of medical discourses. The book is divided into 2 parts: the prevention and treatment of infantile bowel problems, and the life and development of humans. Dedicated to nurses and mothers, it focuses on maternal and pediatric medical care and was one of the first publications produced by an African American on the subject of medicine. The Rebecca Lee Society is one of the first medical societies for African American women and was established in Crumpler's honor. Her home on Joy Street is located on the Boston Women's Heritage Trail. In 2019, Virginia Governor Ralph Northam designated March 30th National Doctors Day as Dr. Rebecca Lee Crumpler Day. At Syracuse University, there is a pre-health group called the Rebecca Lee Pre-Health Society. This club promotes people from various backgrounds to pursue health-related careers. When we consider the fortitude and commitment required to be the first in any field, particularly medicine, where she battled not only racism but also sexism and the compounding effects of both. We think of extraordinary people like her and often expect others to take the same extraordinary leaps without considering how we can all play a role in creating a more just and equitable system that more fairly opens the doors to everyone without dealing with so many additional barriers. As much as we honor Dr. Crumpler, I hope her story motivates us all to create more opportunities for the thousands of aspiring Dr. Crumplers. If you find value in the content we provide on this channel, please hit the like and share button. To get the latest updates, kindly hit the subscribe button. Thank you for watching. See you in the next video.